excited. We had you on before. So those who do not know Dr. Gucciato, he is one of the best chiropractors and nutritionists to my standards in the Queens area. I probably should take off that guardrail and say he is the best worldwide. And it's such a privilege to know him, and the information that he gave us last time was so beneficial about taking care of our bodies. And he did mention a little bit about chiropractic, and today we are going to touch a lot on chiropractic, because it deals with the formation of our body, and with that we know is important because our body is part of our day-to-day life. We cannot come out of our body, and be inside of a new body unless we, do some changes to it. So, Dr. Gucciata, I just want to start by asking, like, what is chiropractic for those who do not know what it is?
Oh gosh. I wish you could see me.
Yeah, me too. I know you're like so animated and excited, and you do like your hand stuff, and then you take the bone structure that might be behind you and you show it. I am so sorry, guys, that you cannot see how this is. I'm so sorry, but go ahead.
Now I have to use my words.
Yeah, could you imagine that? Words without no actions.
You know what? Let's do that. Let's create a visual, right?
Yes.
So, we want to know what chiropractic is, and and most people, even myself, we always associated chiropractic with pain,
Mhm.
with headaches and low back pain and pinching nerves, and that's mainly what we think about when we think about chiropractic. But I would like to share a different view of chiropractic, which is the true view of it.
Yes.
Pain is sometimes part of it, pain is sometimes not part of it.
Mhm.
But to get that visual, let's understand how the body was designed. First thing, when a sperm and egg unite and life is formed at that point, the first thing to actually form is actually the brain stem, the first part of the whole nerve system. From that brain stem, picture this, just like if you plant a seed in the dirt, the
Yes.
first thing that happens is some roots start to grow.
Yes.
That would be just like your brain forming from that little seed, the brain stem. And then you start to get a shoot that comes up through the dirt, and that would be like your spinal cord,
Right.
if you would, growing up from the ground, but for us it grows down to a tail. Now, at the end of at the portion that comes off of that shoot, you have little branches, right? Those little branches are our spinal nerves.
Mhm.
And at the end of those little branches on that little tree or bush that we planted, we have these little blossoms. Those are going to be the flowers or the fruits or things that grow on them. Yes?
Correct.
Well, think about it this way. From that spinal cord, we get these spinal nerves that branch off. And at the end of them, those little fruits or blossoms are your muscle tissue, your heart, your lungs, your kidneys. They form at the end of these nerve endings. And that's how the body is designed. And then God put this whole delicate system
Mhm.
and he encased it in bone, which is your skeletal system, your spine. So when we think about that, now that we have that picture, I want you to picture this. One of those bones gets knocked out of alignment in that spine,
Yes.
and it's not sitting straight like a railroad track. And what happens is that nerve gets altered. That nerve communication gets pinched.
Mhm.
And what happens is that nerve communication to that part of the body is no longer supplying it with what it needs. What do you think is going to happen to that part over time if it's not getting what it needs?
I think if it's not getting what it needs is lose does it lose its function?
Absolutely. You nailed it right on the head. So chiropractic is more about function
Mhm.
than pain because we can lose function before we actually feel any pain. Classic example, a 50 something year old male in great health wakes up one morning, goes out, goes for a jog, comes home, massive heart attack, dead.
Wow.
He felt great that morning. No pain, no nothing. his first sign and symptom, and 60% of 50-year-old males, when they have their first sign or symptom of heart disease, it's massive heart attack and they die. But that problem's been going on for years to decades before a symptom even showed up. So with chiropractic, we have to get out of that pain mentality
Mm-hmm.
and think about exactly the word that you said, function.
Yes.
It's about function. And that's why I use that nerve scanner to tell me about your function in your body. So you nailed it. You nailed it, Crystal. That's awesome. You can come work with me. We're going to make you a chiropractor.
Oh, I would actually love to do that. I would actually
Okay.
love to do that. So you could crack some backs. I
Hey,
remember
hey. We do specific spinal
specific.
corrections. They're
Okay, that's
scientific.
the professional term. I wouldn't be cracking backs like they are, like they're lobsters. I won't do that. Um, with the little claw, I
Yeah.
wouldn't do that. I you mentioned about like the body structure and the chiropractic puts the bones back into its function. So the way that our bodies have been relaxed for the last 3 months, do you
Uh-huh.
think that it has well, I know the answer. The answer is yes. Do you think that it has put our like it has decreased our body's function in a way, so
Well,
to speak?
absolutely. Absolutely. You know, when I listened to the word, I think I heard you say relaxed.
Yes.
So there's a couple of things we can look at. There's two types of people right now during this whole quarantine we went through, right?
Mm-hmm.
The one person is the one who just relaxed, read books, watched movies,
Oh,
sat on the computer. The
eat
other
chicken
one,
wings.
yeah, there you go. And Doritos. Don't forget the
Right,
Cheetos.
and they're far from the ground. These
That's
were the
right.
plant-based ones.
Good, you remembered. But the other person is the one who has the most organized house in the world right now because they did nothing but clean and throw out and clean and throw
Yes.
out and reorganize, right? So we got two people on two different ends of the spectrum. Which do you think did the most damage to themselves over this quarantine time?
The one that wasn't doing anything,
Why?
because like we mentioned earlier, just a few minutes earlier, that if it doesn't have any, like it's not doing anything, it will lose its like ability to function.
Correct.
I'm
The per-
thinking that's not the right answer based upon your
No, no,
enthusiasm.
no. There's no wrong. There's no wrong, right?
Hmm.
With thinking it out.
Yes.
So yes, they are decreasing their function, but think about the person who's lounging on the couch reading a book. Do
Um,
you think they have the best posture in the world?
Not really, because we're kind of like hunched over sometimes, you
You got
know.
it. How about the person reading in bed?
Oh no, they're straining their neck.
Yes. How about the person sitting on their couch with their iPad?
Ooh, no. Their
Yes.
eyes, the
Yes.
light.
Yes. And how about their neck looking down
Right.
constantly on their
Look,
phone?
yes.
So, so you are correct. That person could be decreasing function. But how about the other end of the spectrum, the person lifting, doing all that? Do you think they might be lifting improperly, lifting too much, straining themselves?
Yes, because you need, when you're lifting, you should be lifting from your knees, not from your back.
Absolutely. See, now we're talking. That's awesome. So here's what I want you to think on both ends of the spectrum, then, they're both creating some damage in some way, shape, or form. I would love to, if you allow me to. Can I share the screen? My
You can go right ahead. It's
Let
your
me
show.
see. You would have to enable that. It says host disabled attendee screen sharing. If you can hit that button, I want to show you something so amazing that all your listeners and viewers can see, because it would really allow them to get an understanding of what it's like um, to be sitting improperly and to be
Mm-hmm.
able to give them some ideas on how to correct that.
Okay, so I may have a little difficulty doing that, but I'm sure my technicians will help me. So continue, and I'm gonna get that like all situated out for you and for me.
Cool.
Yes.
So while we wait on that thought, we were talking about what is chiropractic.
Yes.
Now we're talking about during this quarantine time, what is it good, bad? Is someone hurting themselves,
Right.
helping themselves? So my answer would be they're both helping themselves, they're
Mm-hmm.
both hurting themselves, right? Because the one reading and watching, they're pursuing knowledge and wisdom and spending that time. But think about what it would look like with me sitting in bed. A lot of times people lay flat out reading a
Yes.
book and they have like three pillows behind their head so they can lean up to look at their book.
Yes.
What happens is, and I want you to think about this. Picture yourself wearing a football helmet all day long. Do you think that would be comfortable or uncomfortable for you?
Uncomfortable for me.
Yeah, I think it would be uncomfortable for most people.
Oh, okay.
So when you think about it, if you prop like three or four pillows behind you so you're pushing that neck forward to read that book, it's almost like you're tripling to quadrupling the weight of your head because you're pushing it forward where it doesn't belong. If you're sitting on your phone, you ever go on the subway or the buses? I know we haven't been in a long time,
Right.
but everybody's looking down at something.
Yes, that's
All
true.
their necks are tilted down
Mm-hmm.
looking at something. That's a constant downward pressure on the spine, the muscles, the ligaments, the discs, and the nerves. And it creates a lot of damage over the long run. So we need to think about how we're sitting, what we're doing, and try to make it the best that we can, you know?
That's absolutely correct. I was when you were mentioning about when we were talking about if you're sometimes your body can lose its like the bones can loses its function if it's not being properly taken care of. And when I had asked the question about does our body, like, because of the quarantine and we're in a relaxed mode for 3 months, does our body go into kind of some sort of shock? I was yesterday I was trying to like do like a lot of like lifting and stuff, fixing things and whatever. And then I realized that I had like no energy. It's like my limbs were there, but they were not being used. It was like my hands and my legs was like so bored. It was like, who's lifting that? No, we're not lifting it. Me left and me right is not lifting anything. Crystal, are you serious? And I was like, I gotta get into the game. All right, I'm going to find some strength. I'm gonna find some strength. I was like, all right, God, you are my strength. I need you. Like that's the only way I could have done it because I felt like because I wasn't in the everyday, active going to work, using my brain, all those kind of things. Not that I use my brain every day, but I'm just saying it is not like on overdrive because it's not being like needed for like what I would normally do on a day-to-day basis at work. I felt like my body was on some sort of like relax mode, and it was so hard just to get out of that zone. So I didn't know if it was because of the quarantine or is it because my body is just like no.
Right. No, I get it. So think about it this way. You exercise, right? From time to time, you go through periods of exercise, not exercise. Yes.
Yes.
Okay. Think about it when you were younger. Like you could run, you could exercise, do stuff, and it was like little to no effort to do it,
Mhm.
right? But as you get older and you stop exercising and then you are exercising again, every time you stop, whether it be for a month, 2 months, 3 months, a year, think about what it felt like when you tried exercising again. As you get older, it gets harder and harder to get back to that normal rhythm. It takes longer and it takes a lot more effort
Yes.
because we're not circulating our blood through the body the way we normally do because we're
Mhm.
more complacent. We're not doing as much as we used to. So when we go ahead and then try to have a spurt of energy,
Mhm.
we use it up really quick because the muscles are like, no, 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 we're not conditioned for this right now, and it's not getting the blood supply it needs, and it doesn't have that memory or recall like it used to
Mhm.
because we we are getting older, and as we get older, it gets harder to get to those places again. So yeah, absolutely, it'll cause some. If people just took most of the time to relax and just chill, and that's good. We want to, but we also need to keep that balance of movement in our bodies. That's part of life. There's an expression that says movement is life, and it is, because if we stop moving, our lungs stop circulating, our blood stops circulating, our whole body stops circulating. Does that make sense?
That makes a lot of sense.
Yeah.
So, how does someone know if they need a chiropractic session?
Well, a good rule of thumb for that, after what we just talked about,
Right.
is, you know, it's not about pain, it's about
Mm-hmm.
function.
Mm-hmm.
You know, the interesting thing is a lot of patients come in to see me because of pain,
Mm-hmm.
and I'm thankful. I'm thankful, because if they didn't have that trigger, they wouldn't say, "Oh, I need to do something about it,"
Mm-hmm.
right? So not everyone's sitting at home going, "Yeah, I'm feeling awesome. I need to go see a chiropractor." Right?
Yeah.
In their mind, they go pain. But the paradigm should shift, and we actually should be thinking that. We should be thinking, okay, I'm feeling really good,
Mm-hmm.
but I need to make sure that my spine is in alignment and my nerves are functioning at the best of their ability. And you know what, Crystal? If someone comes in to get checked and I see that that is the case,
Yes.
I'm going to let them know. And I'm going to let them know, you're looking good. Come back in 6 months, a year. We'll check it again. We'll see where it's at, you know?
Yes.
But if that same person who comes in with no symptoms and no problems, and they think they're functioning well, and they do need care based on what I see with my exams and x-rays,
Mm-hmm.
then I'm going to tell them exactly what they need. It's really interesting, Crystal. You said the word function. Let's think about what function is.
Yes.
Normal bowel movements, proper heart rate,
Yes.
proper urination, being able to hold your urine,
Mm-hmm.
being able to go to the bathroom normally, being able to walk up a flight of steps without being short of breath, right? Those are all function things. And it's really interesting. I have patients who come in who tell me, had no injuries, I have no pain, my wife just wants me here to get checked.
Mm-hmm.
I go, okay. We look at their spine, and their spine is in like a phase 2, a phase 3 degeneration, which means they've been deteriorating from an injury for about 30 years. And they tell me nothing's wrong. Then we go over the report and they say, oh, yeah, it's been harder for me to go to the bathroom the last 6 months. I have to strain to go, or sometimes I don't go. You see, they don't relate it with the chiropractic. But if we go back to how the body was designed,
Yes.
and we think about the brain's development, spinal cord development, spinal nerves, and then that casing on it, we start to put one and one together, and it makes two. And we go, oh, so if the spine's pressing on that nerve over the next 10, 20, 30 years, that could create a bowel problem. It
Wow.
could create a heart problem. It could create a anxiety problem. It can create a liver problem, because all organs and tissues need 100% communication from the brain to that body part to be functioning at 100% of its capacity.
That is really interesting. So, so like if you're having like like problems seeing, sometimes is it safe to say that it could be based on like some sort of pressure that may be on one of your bones?
On the nerves.
On the nerves. I'm so sorry. Not bones. Yeah, I'm not gonna be a chiropractor.
Yes,
it's on it's on the nerves, not the bones.
but you're 100% correct in what you just said. I'll give you an understanding of that. I have a young patient. He's 20 years old.
Mm-hmm.
Great student, college, blowing it away, just doing awesome. And last year he said something to me which was really, really, really interesting. You know the chair that you sit in my office?
Yes.
And when I scan you and you look at the picture of that head that says body imbalance?
Yes.
Okay. So before I went to go adjust him one day, and he's been a patient of mine since he was probably 12 years old. So he's 20 years old. He's with me 8 years. And he comes from maintenance care to maintain his health.
Mm-hmm.
He says to me, he says, Dr. Rob, he said, I got to tell you something. I never told you this before. He goes, but I cannot see very well. He says, and when I look at that picture, the only thing I can read is the top line because it's big. I cannot read anything else on that. He says, and every time I kneel down and you adjust my neck and I sit back down in the chair, he says, I can read it perfectly. I want you to think about that.
Wow.
So the pressure on that nerve at the
Mhm.
top part of his neck, because the bone is pressing on it and irritating it, the visual ability to see certain things or
Mhm.
see or perceive certain things is altered. And when we correct it and stabilize it, it normalizes. You
Wow.
see? Yeah. Do you know the first chiropractic patient had nothing to do with pain? The gentleman was deaf for 17 years. He bent down to pick something up. He
Mhm.
stooped down to pick something up improperly, and something in his neck popped when he lifted, and he lost his hearing in his left ear.
Are you kidding me?
No, his name is Harvey Lillard. You can look it up. Dr. D.D. Palmer
Mhm.
took the theory and made it scientific on that day, and he gave him about two, three, four adjustments,
Mhm.
and the man's hearing was restored. Because
Wow.
just like when he stooped down and the neck popped, if you realign it the right way,
Yes.
it can come back. It can restore function back. Now, is every person who's deaf going to get an adjustment and get their hearing back? Absolutely not.
Mhm.
Is every person who has heart disease going to get an adjustment and be perfectly fine with heart disease? Absolutely not.
Uh-huh.
But if those nerves affecting those tissues are the problem,
Mhm.
then that person is going to have improvement.
That is incredible. Like seriously. So
Yes.
so how can our day-to-day well, you just mentioned the case just now about he just bent down and something popped and he lost function in his eyes, no, his ears.
His ears,
His
yes.
ears. So what are like some things that we can do, to like try to prevent some mishaps in our bodies so that like these things that are just like they say freak accidents cannot like imbalance our bodies.
Yeah, it could be freak accidents. It
Hmm.
could be silly postures that we use over and over
Okay,
again.
postures. Okay.
It could be the way we lift things, like you
Hmm.
said earlier. Lifting with the knees, not your back. Like
Yes.
people have straight legs and they go to lift and bend. I was running this morning and I saw a woman weeding at 6:45 this morning while
Uh-huh.
I was running,
Uh-huh.
and it was that classic lawn ornament where you just see the polka dot bloomers
Yes.
of the lady bent over. It was her, straight
Hmm.
legs, leaning over,
Yes.
pulling weeds. She's gonna throw it. She's injuring her back continually from doing that. You got to flex those knees a little bit, or
Hmm.
kneel down, get closer, and pull it up gently. You know, the things we do and how we do them will affect our spine over and over and over again. And if we've already had some type of injury from when we were younger,
Yes.
it's just going to cause that spine to deteriorate at a faster than normal rate. And we're going to get sicker and suffer more earlier than we actually should.
Right. I remember you have said if you don't take care of it now, or you say, "Oh, it's not bothering me," but if I clearly come to you and you said, Dr. Gooch, that there's a imbalance in your nerve and over time it will get worse if you don't take care of it, but you're not feeling pain, like you said, sometimes it's not about pain. Um if you don't deal with it now, it's going to get worse over time. So
Correct.
it's important to go get checked out, not just doing your physical health, but do more of your physical health by way of your primary doctor. But I think they should book an appointment to come see you just to check these things, because I remember you told me that you also told me that it's like it's not a pinched nerve, but a nerve was leaning on another nerve, which may cause like headaches or cause like pressure seeing, with my eyes and things of that nature. But if I take care of it now, in the long run, it would rebalance itself to get back in good standing.
Well, yeah. See, that's yeah. With chiropractic, if something is already deteriorating.
Mm-hmm.
The thing that we need to focus on is correcting that. That's
Correcting
called
it, yes.
corrective care. Corrective care has a beginning and an end based on what we know to be true from cases in the past and our research. But when we correct that, we can't just leave it alone.
Mm-hmm.
If you think about orthodontists, a dentist sends you to the orthodontist and says, you need to get your teeth looked at, the alignment, right? And the orthodontist looks at it, and it can be anywhere from 16 months to 3 years that you're going to need, a year and a half to 3 years that you might need braces to correct the imbalance. So they wire you up, they do all that stuff. Let's say it's 3 years later, and now they look at it, they take post images and pictures, and they go, look at that. And you're happy, he's happy, she's happy, right? And now he says, listen, you've done all this good work, everything looks well. Let's fit you for what's called a retainer now. And you're going to wear this at nighttime when you sleep to retain the correction that you've already done, right?
Yes.
Because if you don't, what's going to happen? 2 years down the road, 3 years down the road, the teeth are going to start shifting again. They may or may not get worse. They might just get slightly worse. But again, they're going to shift back.
Mm-hmm.
Your spinal column works the same way. So if we take you through corrective care, anywhere from 6 months to 1.5 years of corrective care, and then we just leave it alone, you're going to go through a cycle of relapse. A year, 2 years, 3 years later, and you're going to come back and go, doc, it's bothering me again.
Oh.
Right? But what did I say? Well, now we need to maintain that with a periodic checkup, but we didn't do that. So what happens is now you go through this cycle of relapse, and every time it relapses, it gets worse and worse and worse. And it makes it harder and harder for me as a doctor to watch that, because I see people suffering needlessly if they just maintained it. So maintenance is just as important as corrective care. Now, Crystal, don't get me wrong. Some people come in, I have families that come in, we check 3 or 4 of their kids, and 2 kids need corrective care and 2 just need maintenance care. And maintenance care can be as simple as getting checked every couple of weeks to every 4 weeks. And the other ones need corrective care because there's more damage there already. See, so if you have things that need corrective care, I'm going to let you know. If you have something that just needs maintenance or wellness care, I'm going to let you know that too.
Right.
If I feel like you don't need any care, well, guess what? I'm going to let you know that too.
Yeah.
But we have to see it first to really understand what we're dealing with. Because if we just go based on, I feel fine, but I look at your spine and it's already 10 years deteriorating.
Oh,
that's a problem. You see, that's a problem.
Yes.
And I wouldn't be serving you well or the patient well if I didn't let you know that.
Correct. And I know that you know exactly what you're talking about, because before you even could make any, I wouldn't say the word assumption, because once you see it, it's not assuming. But once you try to give any advice, you would do an X-ray, and you would you do several X-rays so that you get you can see what is the issue that the person is facing, and the person can see what you're talking about. You're just not saying, oh yeah, your nerves are pinched and you need to come here like for the next 4 months. No, you are showing it. You're showing it on a chart, and you're showing that like one could be leaning against, the nerve could be leaning against another nerve, causing pain or causing discomfort. So I know that we're gonna wrap up in a bit, but is it safe to say that the quarantine for 3 months has kind of like changed our bodies and changed our ability for like stamina, for our everyday function?
Yes, it does decrease that ability, because if we're not functioning to our full 100% capacity, or as close to it as we can, we're not functioning the way we're intended.
Correct.
We're just not functioning the way we're intended. Yeah.
Okay, so are you taking any are you taking any new clients, or I know walk-ins are not happening right now, but are you taking any new patients?
Well, we're pretty much almost back to normal routines. We've just taken extra precautions, and screening, and screening people at the door, and taking temperatures, and making sure that we're going over and above what's expected at this time. So we are, and one thing I did want to share with you, because people are a little squeamish and you know, of being in rooms together and things like that right now,
Mm-hmm.
and there's different thoughts and fears and emotions. You know, normally I do my spinal care class, so I would definitely invite all your you know, listeners,
Yes.
viewers, to register for one of my classes. But one thing I have done is, because of how things have changed, I created my spine care class and put a video together of
Okay.
that spinal care class. It's about 40 minutes long,
Mm-hmm.
and it talks about the images that I did want to show, you know, like with posture and texting and reading and sleeping and, you know, driving and what all that looks like. So, what I'm going to do, and I just thought about that, is all your listeners and viewers, if they would like to put their email address, I guess, on this live talk that
Uh-huh.
you're having,
Mm-hmm.
what I can do is I can put them in my queue and I can send them that orientation video
Mm-hmm.
for them to view in the
Okay.
privacy of their own home, on their own computer, on their own TV. I'll send them that link. This way they can acquaint themselves with who I am,
Mm-hmm.
what I do, and how we can benefit them, if anything.
Mm-hmm.
And we'll allow them to do that. And with that, they have the opportunity for a complimentary consultation as well.
Oh, that's fantastic, Dr. Gucciardo. And I do thank you for that. I'm gonna get all of the emails and send it over to you. Is there an age limit to you know, the youngest of who can do chiropractic or have these
Great
consultations
question. Great question.
before you go?
We check babies the day they're born. You know, if parents are understanding what we do, they ask us to check their babies when they're born.
Mm-hmm.
And it could be a simple thing as taking a temperature reading to see how the nerves are functioning. And they might not need an adjustment for 6 months, a year, 2 years. So the checkup is critical because we catch things before they become a problem. You
Okay.
see? And then we keep that body functioning as close to 100%
Mm-hmm.
from birth to the grave. That allows for the best expression of life. God has given us an amazing ability. When we look at how the body's designed and we look at what He's made and created in us as His people, and it's just amazing. And I am so excited to have that opportunity to manage that
Yes.
for. And so we check them from as early as day one, minute
Mm-hmm.
one, all the way up until the last breath. So there is no age barrier to that,
Mm-hmm.
because that misalignment of the bone can start at birth if there was birth trauma.
Oh yes.
Yeah, you see, think about it too. You ever watch those funniest home videos where you
Oh
see that
gosh.
little kid just starting to walk and that dog comes running across the room and pummels that kid down to the ground?
Oh yeah, and they win
We laugh.
$25,000.
Yeah, we laugh. We giggle because it's kind of funny.
Mm-hmm.
But think about what just might have happened to that kid.
Yeah.
It might have just decreased his potential. And if we didn't check it at the right time, that could cause pain and suffering in the
Yeah, and they
future.
have to use the $25,000 to fix his spine.
There you go. See, you caught on, Crystal. I love it.
It's a trap.
So if you want to do that, if your listeners want to pop in like on the comments and put that
Yeah,
there,
I'll get
or
that
you
for
want
you.
to file it, I'll just get on. I'll take their emails and I'll send them that link, and they can view it in the privacy of their own home.
Yes, I'm gonna get that information for you.
Excellent.
Yeah, because we have some great comments here that you are the best, and they some of them have been to you, and someone said it's time to see Dr. Gucciardo. It's very good. Yes, it is time to see him. There's this one question: how do brain tumors occur, and what can we do to prevent it? So how do brain tumors occur, and what can we do to prevent it?
You know, that's a great question, and to really answer that, I think my orientation video will answer that
Uh huh.
question. But think about it in a simple sense. When we talk about putting pressure on a nerve and reducing the function to that tissue.
Mm-hmm.
When that happens, the body responds to that, and cells can change and deteriorate and change their form.
Mm-hmm.
And it can become a tumor, it can become cancerous, it can become all those things. That's the beauty of what we do, because I don't want to say we're going to prevent someone from having cancer,
Right.
but we are going to prevent someone from going down a road sooner than they should. Um, all a tumor is just a changing of a cell tissue for some odd reason. And that could be because of nerve pressure. That could be because of chemical toxin poisoning.
Yes.
That could be because of a genetic malfunction. Like,
Mm-hmm.
there's so many different things to consider. But my closing thoughts on that is, we talked about it last time.
Yes.
Make sure that you're eating as healthy as you possibly can be, with
Yes.
minimal preservatives, minimal chemicals.
Mm-hmm.
Eating, like we said, from the ground,
From the ground, not off the ground, guys. From the ground.
right.
Yes.
So we want to do the best we can with that. We want to make sure that we get enough movement
Yes.
and life. We want to make sure that we do have a positive mental attitude about things and a good spiritual outlook about things. And we want to make sure that we get enough rest, and we want to make sure that we get enough play, and we want to make sure that we get enough nerve function and keep our spines in line. That would be my answer. And then we can talk about, I know you mentioned wanting to talk about what can we do nutritionally to support our spinal health and our nerve system. I'd be more than happy. We can talk about that next time. We can talk about different avenues.
Of course, we will have you back, Dr. Gucciardo. You are I think the correct word is plethora of knowledge. If I use that word incorrectly, we have another word, which is you are a like a balloon of knowledge. Like, it's all inside of the balloon. And
you used the right term.
Plethora? Yes. My SAT words from like 15 years ago is now kicking in. So I'm so happy about that.
Awesome.
Yeah. So we just want to thank Dr. Gucciardo again. Thank you so much for stopping by. I'm sorry, guys, about the video and the video sharing, but I'm very happy that we were able to hear you, and our guests, our listeners today were very pleased. I'm gonna get that information for you, because I know some of them want to get that information about the classes that you have, and from there I hope that they take advantage of the free consultation, because we learned a lot today about the the spine function, about our nerve functioning, and sometimes we may have an unbalance and don't even know it, and we're thinking that we need to get glasses, bifocals, all these things, when something is just leaning on something else that's causing you to have declining in your eyesight, or declining in the way that you walk and things like that. So it is not going to hurt you to it's not going to hurt you just to go see Dr. Gucciardo. I guess, again, he is one of the best, not on the block, not in the borough, but in the world. And he did not give me $5 to say that. He gave me $6 to say that. I'm just kidding. He is like one of the best, and again, he is a man, and the bonus is that he is a man of God. So he's not gonna sit there and just kind of like play around with words to get you all emotional about your nerve system and all those things. No, he's honest, he's truthful, and he has a great staff that can that knows that their boss is he is transparent, and I feel safe when I go there and know that I'm going to get the correct information. So again, we thank you, Dr. Gucciardo, because we know that you have to go do your Gucciardo thing today, and make somebody very happy, and get their health back on track. We do thank you very much, very, very much. Can I get some hand claps there in our chat room? Go ahead, Dr. Gooch.
I thank you, your dad, your mom. I think you guys are absolutely amazing. I see your love and compassion that you have for God's people. and those who are not God's people and you want them to be.
Mm-hmm.
I see it, I feel it, I experience it, which is why I love you guys.
Thank you.
And I'm just so thankful that you asked me, because I can support your ministry by being part of that and encouraging your people.
Mm-hmm.
It just makes me feel awesome to be involved in that. So I thank you for allowing me to be part of your greatness and all the great things you do for the Lord, not for yourself, not for your own glory, but for His.
Yes.
And that just blows me away that I can be included in that. So
Mm-hmm.
thank you, and I appreciate you.
You're very welcome, Dr. Gucciardo. We are very happy. I have one person say they don't mind coming from New Jersey to come see you. Do you understand that? That's a whole toll booth.
Yes.
Toll booth. Yeah, not a whole toll booth, but you know what I'm saying. That means that they're serious. That's going and coming. That is not that means that they heard something that they are very pleased with, Dr. Gucciardo. And again, we thank you. We thank you. We thank you. Until next time, we would hear from you, Dr. Gucciardo.
Awesome. Great day, guys.
Yes. Have a great day, doctor. So for all my Facebook family who is listening, thank you so much. Thank you so much for being with us today. It was a great session. I really hope that you guys paid attention. I'm going to put all of the information on our Facebook so you can get in touch with Dr. Gucciardo, and please message us all of your email address. Your email address is in our messages so that we could get your email address so that we can get it to Dr. Gucciardo so that he can send you the information about his virtual class about our spine and our nerves and all of those things that we talked about today. And then I really would like if you can take advantage of the free consultation. You don't get free these days. So please take advantage of the free consultation that is going to be being offered to you. Again, message us your email addresses so that we can get it to Dr. Gucciardo. He is right here in Cross Bay, which is Howard Beach of Queens, in Queens, and it's not far. You would be very pleased. You would be very pleased with the information that he will be giving to you. So I hope that you guys do that, and I'm really thankful for you guys joining in today. Remember to eat food that is closer to the ground, meaning like a plant base. Not so make sure it grows from the ground, not that it's on the ground. Do not pick something up off the ground and eat it and say that Crystal said to eat from the ground. No. Eat closer to the ground. And make sure that when you're looking at your computer and stuff, that you're in a relaxed position, that you have a great posture. Do not bend your neck all the time to read your phones like this. Don't do that because it's messing up your spine. And even if you don't have pain, just take advantage of doing the free consultation. You would be amazed to see what Dr. Gucciardo can tell you about your spine. All right. So with that said, it's been another Friday takeover with me. So join us next week for another wonderful broadcast. It's great to see you all. Want to give a couple of shout outs to people here in our Facebook today, our Facebook family, near and far. We just want to thank you so much. Thank you so much for all those who are on here. I see you guys. Thank you for joining us, spending like an hour and some change with us. And so now you can go and eat your food and drink your tea and juice. Have a wonderful day. Until next time, America, love yourself and love each other.